In some European nations, men live up to 10 years less than the European average. In others, there are many more obese adolescents than adults. In others still, a quarter of deaths are caused by smoking, and some of these are also the nations with the highest alcohol-related deaths in the world. These are just some of the data that show the poor health status of some European countries. In this video, we will see exactly the 10 European countries with the worst health indicators, also discovering which nations have the lowest life expectancies. We will report the ranking compiled by the Legatum Institute, enriching it with various information taken from scientific studies in the field. Welcome to this new video by Amazing Europe. Number 10. Belarus. In Belarus, there is a huge difference in life expectancy between men and women. Here, women live on average more than 10 years longer than men, and this is due to multiple causes. First of all, men in Belarus drink much more alcohol than women. While the World Health Organization recommends that men consume no more than 9.7 liters of pure alcohol per year, Belarusian men consume 18.2 liters, while women only 4.9. It is important to remember that pure alcohol refers to the total amount of ethanol present in different quantities in various alcoholic beverages. Belarus is the leading nation in the world where people die from alcohol-related problems. Another problem is smoking. In Belarus, men smoke twice as much as women. Furthermore, while only 6.8% of deaths among women are caused by tobacco, the percentage rises to 30.2% among men. However, women are more obese than men. In fact, 21.2% of women here are obese, which is one of the highest rates in Europe. However, only a quarter of the population engages in physical activity. Number 9. Bulgaria. According to Eurostat data, Bulgaria is the only country in the European Union where life expectancy has decreased in recent years. According to various studies, this would be due to an unhealthy lifestyle of Bulgarians. 15.6% of Bulgarian men are obese, and an additional 48.8% are overweight. Bulgaria is the country where the least vegetables are eaten among those in this ranking, with 86 kilograms of vegetables per capita per year. The situation is worsened by the sedentary lifestyle of the inhabitants, even from childhood. About 70% of children and young people in Bulgaria spend 2 or more hours sitting in front of a recreational screen or a tablet. Only 16% of children spend less than an hour in front of a recreational screen, while 15% spend more than 6 hours sitting. Smoking is also a serious problem, with 38% of adults smoking regularly. Smoking in Bulgaria has a significant economic impact, with an estimated annual cost of over 2.1 billion euros. This includes direct costs related to healthcare spending and indirect costs related to lost productivity due to illness and premature death. Number 8. Albania. In Albania, people drink much less alcohol and eat many more vegetables compared to the two countries seen so far. However, in Albania, people consume on average more animal protein than the maximum threshold recommended by the World Health Organization. Furthermore, there is a lot of physical inactivity, with 60% of men and 67% of women reporting not doing even a minute of physical activity per week. The regions where more sports are practiced are Berat and Fier, twice as much as Dibba and Kors. Another big problem is smoking, which is particularly prevalent among men. Just over half of Albanian men smoke daily, and 22% of all deaths in Albania are caused by tobacco consumption. In this small country, the percentage of diabetics is also very high. In fact, 11.5% of adults suffer from this disease, although there are countries in this list with worse percentages. This country is the 4th nation in the world with the most deaths caused by bladder cancer and complications related to Alzheimer's and dementia. Another factor that puts Albania in this ranking is that it is the country in this ranking with the fewest doctors, only 1.9 per 1,000 inhabitants. Number 7. Romania. Romania is the country in Europe where people drink the most alcohol, even among women. Each year, they consume the equivalent of about 17 liters of pure alcohol. To put that into perspective, this would correspond to about 33 centiliters bottles of 5% alcoholic beer per week. Another peculiarity of Romania is that in this country, boys are more obese than adults. The obesity rate among boys is 17.3%. While among adult males it is 11.1%. However, if we consider people who are overweight but not obese, adult males hold the top spot. In fact, 67% of them are obese or overweight. Smoking is also very common among Romanians, although not as much as in the nations seen so far. Regarding sports, according to the Romanian Statistical Institute, only 11% of people between the ages of 25 and 34 engage in physical activity. As for the healthcare system, the rates of treatable mortality, which are deaths that could have been avoided if the person had been adequately treated, are much higher than the European average. In fact, if in the European Union the avoidable deaths are on average 92 per 100,000 inhabitants, in Romania they are 235 per 100,000 inhabitants. Number 6. North Macedonia. North Macedonia is the country on this list with the most smokers. 47.1% of men and 31% of women smoke regularly, which causes 24% of deaths in this country to be caused by tobacco. Another major cause of poor health for Macedonians is pollution. 12.7% of deaths in this country are due to pollution-related causes, making it the first nation in Europe in this category. North Macedonia is the first country in the world for deaths due to heart inflammation, although the leading cause of death in the country is stroke, with 24% of deaths due to this cause. In Macedonia, it is estimated that 64% of the population is physically inactive, with women being more inactive than men. This inactivity leads to obesity, especially among adolescents. More than 15% of Macedonian boys are obese, compared to about 10% of adults. However, if we consider overweight people, here adult males are the winners, with 64.4% of them being obese or overweight. Number 5. Serbia. Serbia is present in several unfortunate top 5s. It is the fourth country in the world for deaths due to indirect causes related to multiple sclerosis, and third in the world for deaths due to schizophrenia. Of course, we remember that multiple sclerosis and schizophrenia do not directly kill a person, but they can lead to various types of complications that can indirectly lead to death. It is also the second country in the world for deaths due to heart inflammation and lung cancer. Together with another country that we will see, it is the country in this ranking with the highest percentage of diabetics. 12.2% of adults in Serbia suffer from diabetes, and diet is the main cause in this. In fact, with 94 kilograms of vegetables consumed per capita per year, Serbia is one of the countries in this ranking where people eat the least vegetables. In Serbia, men and women smoke equally, and the consequences of smoking cost the Serbian state around 1.8 billion euros. Number 4. Moldova. We were surprised that the Legatum Institute did not rank Moldova higher in this list, as it is the country in Europe with the lowest life expectancy. If the average life expectancy for women across the European continent is around 81 years and for men it is 75 years, in Moldova women live an average of 74 years and men 65. This means 7 years less for women and even 10 for men. In this country, there is a huge difference between the percentage of smokers between men and women. If only 7.2% of women smoke regularly, the percentage rises to 40.6% in men. Another serious problem is obesity. 24% of women and 21.4% of men are obese. If we also consider simple overweight, even 70.8% of adult Moldovan men are either overweight or obese. One last curiosity, Moldova is the first country in Europe for deaths due to poisonings, presumably accidental. There are 4.53 deaths per 100,000 inhabitants related to this cause. Drug poisoning accounts for the highest number of cases, followed by alcohol poisoning, gas poisoning, and pesticide poisoning. Number 3. Bosnia and Herzegovina. Together with Serbia, Bosnia and Herzegovina is the country in this list with the highest number of diabetics. In this country too, there is a large number of smokers. 30.5% of women and 45.1% of men smoke, which causes 25% of all deaths in this nation to be caused by tobacco. On average in Bosnia and Herzegovina, a smoker must spend 6.1% of GDP per capita to buy 100 packs of cigarettes in a year. Regarding obesity, 20% of men and 24% of women are obese. However, the condition of adolescents is decidedly better, as only slightly more than 3% of them are obese. This is also thanks to the fact that 44% of girls and 56% of boys do physical activities. Surely more could be done, but it is still one of the highest figures among the countries in this ranking. After North Macedonia, Bosnia and Herzegovina is the second country in Europe with the most deaths related to pollution. Number 2. Ukraine. In this country, there is a substantial difference between men and women in several categories. Regarding smoking, 42% of men and 14.4% of women smoke in Ukraine. Smoking in Ukraine has an economic impact of 3.7 billion euros. This covers both direct costs from medical spending and indirect costs from reduced productivity due to sickness and early death. Another difference between men and women is the obesity rate. 20.1% of men are obese, compared to 29.8% of women. Ukraine is among the countries in Europe with the highest rate of depression. In 2019, before the war, 5.2% of the population suffered from depression. Now, of course, the percentages have increased. It is estimated that 22% of internally displaced people suffer from depression. The mortality rate in this country is among the highest in Europe, even independently of the war. Smoking, obesity, poor diet, and other factors contribute to half of all deaths in Ukraine being due to coronary heart disease. Before revealing the European country with the worst health indicators, if you found this video informative, we kindly ask you to support our project by liking, subscribing to the channel, and clicking the bell to not miss new videos. Thank you very much. Number 1. Montenegro. According to the Legatum Institute, Montenegro is the European country where inhabitants have the worst health conditions. One of the main causes of poor health in this country is smoking. Montenegro is the country in this ranking with the highest number of deaths caused by smoking, accounting for 28% of total deaths in the country. Obesity is also a big problem, with 25.2% of women and 26.0% of men living with obesity. Children are also affected, 13% of them are obese, to which is added a further 18.1% of overweight children. But what is most worrying in Montenegro is the health system, defined by several sources as the worst in Europe. A study showed that Montenegrins believe that successive governments have misspent money on healthcare. Each year, the government spends more than 200 million euros on healthcare, which is equivalent to 9% of its budget and over 4% of Montenegrin GDP. However, all this is for a health system that does not satisfy the inhabitants. For example, in the first 6 months of 2019, there were 265 hospital infections caused by inadequate hygiene. In 2014, there were only 28. Another worrying factor is that there are not many doctors in Montenegro, as many emigrate abroad. Even more worrying is the shortage of pharmacists, only 17 per 100,000 inhabitants in 2015. This is the ranking drawn up by the Legatum Institute. Now it's your turn. Tell us in the comments what you think and share your experience. If you want more precise data on the health or diseases of these or other countries, you can also ask in the comments. To cheer you up, you can take a look at our video on the 10 healthiest European countries. You can find it here at the top right. Well, that's all for this video. Have a nice day and see you next time.